Hi, I'm Dr. Kylie. I'm a wife, a mother, an entrepreneur, and trained chiropractor. But I don't do chiropractic anymore. I run a completely virtual online clinic that is all functional medicine based. And today I'm going to teach you that a CBC can become your best friend. But I'm going to make it your friend first. Because right now I know a lot of my colleagues and my classmates were terrified of numbers. For some reason, I just picked up on it. And I've taken multiple hours of additional training on CBCs, metabolic panels, iron panels, cholesterol panels, I mean, you name it. Those lab tests that your patients have already taken, you're going to become an expert at the CBC today. It's going to become your new best friend. But if it's going to become your best friend, you're going to have to take what you learn in this webinar and apply it to your patients. Because I can only get you friends with it. It's going to take your practice, your skill, and your trial and error to become best friends with it. But I will, at the end of this webinar, at the end of 30 minutes, you're going to understand how to read a CBC better than you've ever understood it before. And not only are you going to understand that CBC, but you're going to be able to understand what to do when those markers are off. All about Systemic Formula's amazing supplements. So let's dive in. Let's talk about this CBC. Before I flip the chart over and give you the numbers, I'm going to just walk through numbers with you and markers and patterns. I'm not going to go into the why. We don't have time for why today. But what I want you to know is that the markers and the labs that you're about to see, the ranges are different than those ranges that you see as normal ranges on a typical panel. If your patients come in and they say, I am so tired of taking labs and not getting results and being told that I'm normal and nothing's wrong with me, then you need to learn how to read it in a very different way. This is for you if you're struggling to get remarkable results with your patients, if you're struggling to overcome that mediocrity mark there. This is for you if you simply want to learn how to read a CBC better. This is for you if you're like me and your patients don't have money coming out the woodworks. There are a lot of functional medicine labs that we can take. Those cost money. What if you could get the similar information from a lab test they've already taken, they've already paid for, they've already donated the blood for? All you have to do is 1, request it, or 2, have them get it for you, or 3, you order it. It's that simple, and a CBC costs literally about nothing, especially if they go through insurance. So that's why this lab test is going to become your best friend, because it's such a common test to take that your patients would love it if you could get the same information that you could get from that functional medicine lab test that costs $400 from a lab test that they've already done that costs them $4. Let's take a look. Okay, like I said, these lab ranges are different. This white blood cell count, your optimal range here, is what I'm going to call it. Optimal or functional, whatever you want to call that range, is 5 to 8. That is different than an MD or a DO or somebody trained to just see if it's a high or a low marker on a regular panel. Like I said, if your patients come in and they say, oh, I've had tons of blood work and everybody just tells me that I'm normal, this is where you come into play. This is where this comes into play. Because this takes that normal lab test and it gives them information. It gives them answers that they've been searching for years. And now you're the hero, not their MD. So that lab range is different. All of them are going to be different. These lab ranges I pulled from Dr. Kureisen's functional lab test ranges. That's where I get these numbers from. But like I said, it's your job to figure out the whys behind everything. Definitely don't have enough time to get into it. When it comes to a CBC, make sure you get a CBC with differential. It drives me bonkers when I order medical records or I request medical records and they have a CBC with no differential. It doesn't happen often, but it happens just enough. It drives me crazy. A CBC with differential, it's like Christmas morning to me, and it's going to become Christmas morning to you as well. Because you need to know neutrophils and lymphocytes. Now, I've paired these three up for a reason. There's a pattern that you're going to want to know here. First, the white blood cell count. If you see that the white blood cell count is low or high, you have an active or chronic viral or bacterial infection. Now you see that on that chart that came with this webinar. Be sure you have that chart. Take notes vigorously on it. When I see the white blood cell count is either high or low, I'm going to then ignore everything else on that CBC and jump straight to neutrophils. You want neutrophils to float around 60. That's the ideal territory for them to be at. Then you go to lymphocytes. Lymphocytes, you want them to float around 30. You can identify if they have an autoimmune flare simply by these three markers. Here's how you do it. You want neutrophils and lymphocytes. You want that ratio to be 2 to 1. 60, 30, 2 to 1. That's a normal, healthy range. If it is not, if you're seeing a 1 to 1, you are in an autoimmune flare. Doesn't tell you what autoimmune, but you know that you're in an autoimmune flare. So these three markers are my favorite. I'm going to get into a case later on that will walk you through how to put this all together. But just know, if white blood cells are high or low, jump straight to neutrophils. Here's your range, but you really want it to be closer to 60 than anything. Not over 60, but closer to 60. Lymphocytes, here's your range. Your ideal territory is 30 and floating around 30. There's the pattern. Now neutrophils fight bacteria. Lymphocytes, they fight viruses. So say you have a white blood cell count that's low. I know that it's an active or chronic viral or bacterial infection. I don't know which, just based off of white blood cell count. But then I can jump to neutrophils and say neutrophils are, for example, 70. And lymphocytes are at 28, for example, here. I now know that that is a bacterial infection because my neutrophils are high. I know that my lymphocytes, they're low. It's not viral. So you can go from white blood cell count, knowing that it's a viral or bacterial infection, and then use the neutrophils and lymphocytes to determine which one is which. Neutrophils fight bacteria, lymphocytes fight viruses. This is all going to make sense when we put it together, but just know these three markers are going to become your best friend. Then you jump down to red blood cell count, hemoglobin, hematocrit, MCV, MCH, MCHC, and RDW. All these markers signal iron, anemia, or B vitamin. anemia. If they're on the high side, it's B vitamin anemia. If they're on the low side, it's iron anemia. Now, I will tell you, I've looked at a lot of lab tests and CBCs, and you don't ever get a clear one or the other. A lot of times red blood cells will be high, and you'll have maybe 2 or 3 of these markers on the low side. When it comes to B vitamin anemia, I think about more along the lines of methylation rather than an actual depletion of B vitamins. So when it comes to methylation, you want to use MORS. That is a remarkable supplement that helps their body do the right things with B vitamins. Iron anemia, if they have any signs of iron anemia, I can almost guarantee that that iron panel was not taken. I've had very few docs take iron panels, except for the ones that I mentor. I drill them on taking an iron panel and when to take it. So most often the times, if you're requesting a full medical record panel, you will not see an iron panel. Very few occasions you'll actually get an iron serum, but it's not a full iron panel. So if you have high blood cells, high red blood cells, think about B vitamin anemia. If they're low, think about iron anemia. And if they have any sign of iron anemia, you have to fix that anemia first before you do anything else. Your blood, your cells need oxygen. Iron is responsible for transporting oxygen to your cells. And you can't heal if your cells don't have oxygen. So focus on these. All of those markers are for just those anemias. Okay, then we jump down to monocytes, eosinophils, and basophils. This is part of the differential part there. Monocytes. These guys are viral, specifically Epstein-Barr virus, if you're approaching 10 plus. Monocytes, if you're floating between 8 and 10, you have a very low-grade viral infection. A lot of times, it's somebody who's been diagnosed with Epstein-Barr virus in the past. They're dealing with a lot of chronic fatigue right now, and there's that little guy is not quite dormant. It's just floating around doing enough damage to make them feel like crap. When you can figure this out and identify that that's still a component to their chronic fatigue, all off of lab tests that they've already taken, you're now the hero. One quick example here. I was going through a medical record request form, all of the labs. I mean, I usually pull everything about 7 years back because, as you know, doctors have to have records on hand for 7 years. So I pull as much information as I can, and I trace them along throughout the years. And for this gentleman, he's mid-40s. He's just gotten divorced because his health is so bad he can hardly function throughout the day. Chronic fatigue is the name to his game. He went in and saw Cleveland Clinic, the Cleveland Clinic, ladies and gentlemen. And they put him on testosterone. He had on his lab test from Cleveland Clinic, which I requested, had low or a positive Epstein-Barr virus. He had low testosterone and a couple other things, and they only cared about the testosterone. Epstein-Barr virus, all they had to do was give this. Now, I don't think the doctor knew about systemic. If they did, that is the #1 supplement I sell. I can't keep Vivi off on my shelves. So many people who have Epstein-Barr virus, a history of Epstein-Barr virus, or any viral infection at all, Vivi is going to become their best friend. Now, I was going through his labs, and I said to him, you know, if you were to take this lab at this specific time when Epstein-Barr virus came up, I would have expected it to be above 10, maybe 10, 11, 12, possibly even 14 and get that high. And he said, you know, it's funny that you say that because I did have a marker that high, and I went to a doctor in Georgia who said he focused on monocytes. He focused on viral infections. I said, that's interesting. What did he do for treatment? He said he focused on omega-3s and omega-6s. That was his treatment plan. And this patient of mine stuck with it for a year, didn't feel much different. And I've seen omega-3s and omega-6s are marvelous. They work great. They're good anti-inflammatories. You guys know all about them. But this guy, I put him on it first. He was on it for 2 weeks, the first of treatment. Not a single nap taken. He went on family vacation with his family for the first time in years. And he's like, I might actually be able to start that business that I've been wanting to start, all off of this antiviral. So any type of monocyte activity above 7%, give them Vivi and they'll love you. Eosinophils and basophils, these two go kind of hand in hand. You're looking at food sensitivities and or parasites. Now this is all in my head because I've done it so many times now. It will all get in your head too with practice. Food sensitivities, I don't know what your guys' patients are like, but mine, they come in and they've depleted everything. They're not eating a dang thing at this point. Where's my water bottle? Sorry. There it is.
A tag on your shirt.
I left it on my shirt, so it's probably still there.
You want me to take it off?
Sure.
Just tuck it in.
I don't care. There's the one that you can just...
It's strings.
Yeah. Just pulled these maternity clothes out, so... Sorry, I just know I'm not going to be able to continue on if I keep going. Good? Okay. All right. Think where I was here. Sensitivities and... Okay. Most people that come in and I see, they've depleted everything from their diet, so it can't be food sensitivities. A lot of them have even taken food sensitivity panels through their primary care physician. So when I see this, I'm a big fan of treating parasites because if you're not treating parasites, that's because you're not looking for them. Any type of indicator that's high, think parasites, especially if they've cleaned up their diet really well. Now here's the cool part. All of the differential part of that CBC, it adds up. So neutrophils, 60, lymphocytes, 30, monocytes, 6, eosinophils, 3, basophils. It all adds up to 100%. Kind of handy, right? It's a good way to remember things. Remember, as a quick review, neutrophils, they fight bacteria. Lymphocytes fight viruses. Monocytes are another viral indicator. Eosinophils and basophils are the food sensitivities and the parasites. You want these guys, you want a 2-to-1 ratio. If it's a 1-to-1 ratio, you have an active autoimmune flare. So let's take a look at what this all looks like put together in a case. Now these lab tests are taken from a Parkinson's case. A little bit of background information here. This patient is, I don't know, she's 49 years old right now. She got diagnosed with Parkinson's 10 years ago. And she should have been diagnosed with Parkinson's 5 years before that, but nobody would believe her. So she's a very early onset Parkinson's victim. Her dad also has Parkinson's. He got diagnosed around the age of 60 and now suffers with major Alzheimer's and is bedridden. She does not want to go down that path, even though most of the family think that's where she's headed. She wants to prove them all wrong. So when it comes to this case, know that I pulled 7-10 years of medical records. I pulled all of her medical records from anywhere from hospitals to primary care docs to clinics. Anything that had any record on her, I pulled them. And you can do the same too. It just takes a simple medical record request form. You have them sign it. I fax it off. You can fax it off to whatever clinic the case may be. And within usually 24 to 48 hours, I receive the fax back of their medical record. So it's very efficient, very easy. That way the patient doesn't have to worry about it, and it's all on you or your assistant, whatever the case may be. So when it comes to Parkinson's, she's dealt with it for over 10 years. Some things have helped reduce her tremors, some things don't. She's on medication. She hates going to her neurologist because all they do is change my medication, and I feel crappy for a couple months afterwards. So she's almost stopped going to them. You guys know the story. But one of the key symptoms I want to point out here before we dive into the numbers is she has had chronic UTIs. These UTIs have been 2-3+ years. The way she said it to me was that she probably always has a UTI. She just doesn't know it unless it's bad, meaning that she doesn't know it unless there's blood in her urine. That's her indicator that she's got a chronic or an active UTI. She still thinks it's always there though, despite multiple rounds of antibiotics. So that's a key point here. All right, so what I have listed are just one set of labs. Like I said, I pull all of her medical records. So when I go through her labs, I do like 10.0, and then I list out all of the other scenarios, and I usually do 3 or 4 at a time. But what do these numbers mean? White blood cell count. This one is elevated. Look back at your chart so you know the ranges here. 10.0 is above that 5 to 8 mark. It is high. Ignore this. Skip to neutrophils and lymphocytes. I'll do that on the next page. But right now, all of these are normal, so we can rule out iron and B vitamin anemia. It's this guy we want to pay close attention to. Now, my assistant is the one that punches all the numbers into my computer. It probably takes her anywhere between 30 and 60 minutes, depending on how many labs there are. But when she punched these numbers in, she came back and told me, handed me the chart that we use, and she was like, "It's Christmas morning, here you go." The joke in my office is that if I get a really good lab test, it's like Christmas morning to me. It is so fun to be able to dissect numbers and to tell them what's going on, what's causing their symptoms, and most importantly, give them a treatment plan that not only do you know it's going to work, they know it's going to work too. So here we go. Christmas morning for me and for you guys, student. White blood cell count high. RDW platelets. I really don't pay attention to these. I've never actually seen them out of that range, so maybe on rare occasion they will. If you find them, find a textbook that will tell you the answers. Okay, so white blood cell count, jump straight to neutrophils. This guy is high. What do neutrophils do? Remember, they fight bacteria. Lymphocytes, low. Okay, so we can rule out that virus. It's not active right now. There's a bigger player here in the picture, and it's this bacterial strain. 60-30. That is definitely not a 1-to-1 ratio. So we don't have an autoimmune flare. We know that she does have Parkinson's. She's probably, when it comes to actually tremors, like she would just sit there and go like this. And it's been greatly reduced since she's been doing some alternative things on her own before coming to see me. Monocytes here, 6.2. Previously, she's had labs that say 7.4 and 7.5. She also has a history of Epstein-Barr virus. So that's where this would come into play, the slight elevation there. When these labs were taken, she had that low-grade Epstein-Barr virus that played a little bit of an impact on her chemistry and the way she was feeling. Eosinophils, basophils. Basophils look good. Eosinophils, now I will tell you, she's not one that has dived into food yet. So we've got to work with some food, but I will also tell you that there's a possibility of parasites inside of her. She grew up on a farm in rural central Utah where she remembers going out on the four-wheeler with her dad and they would spray chemicals. It was like when pesticides just come out and she was a young girl. So she was always around chemicals and the farm stuff. So we have neutrophils high. We've got some signs of food sensitivities, possibly parasites. We've got history of Epstein-Barr virus, all off of one lab that she's already taken and hasn't had to donate another piece of blood or quart of blood or given another dime for it. We got all this information off of labs that you don't have to order and she doesn't have to go get. Now, here's where the Christmas really comes into play. On the additional notes section, when you go through all of our labs and you get all of our medical records, there was a history of Epstein-Barr virus, positive and negative, and there were a bunch of Lyme's disease antibodies taken. Now, they were never positive, but her Lyme's antibodies, I believe at one point were at 0.33. And I know as well as you know that Western medicine, when it comes to testing for Lyme's disease, it is not the best test. So the fact that she does have some Lyme antibodies in there makes me wonder if Lyme's is causing this. I was doing some research, and sure enough, Lyme's disease is a bacterial strain. Don't remember what it is off the top of my head, but I firmly believe, and I've already talked to her about this, that Lyme's disease was a huge factor in her body shutting down, in her nervous system being attacked. And it had been bypassed for all of these years. She just got told Lyme's disease was negative, so therefore she didn't have Lyme's disease. Here's the second component. Not only does it match this, chronic UTIs is a huge sign of Lyme's disease. I didn't know that until I started doing research when I was looking through her labs. So you put all the puzzle pieces together and you start piecing together the patterns, and you can find some pretty dang cool stuff. And now you're the hero, and they trust you, and you have a plan moving forward. So the first thing that we have done is we started off by attacking the Lyme's disease to try to get these UTIs to go away. And we're in the middle of the VRMs, 1, 2, 3, and 4 with bind and WO oil. Yeah, that's where we're at with treatment right now to tackle that Lyme's. So once we tackle the Lyme's, once we completely destroy your gut, we're going to rebuild it. We're going to build the leaky gut, and it's at that leaky gut time that I start pulling foods. I help them with the anti-inflammatory diet. I walk them through that at that leaky gut phase, and then we replenish everything in the gut with things like MBC, ABC, DS for some hydrochloric acid and enzymes with MELA or NZ. All of those good gut replenishing things. When it comes to attacking the Lyme's, I'm basically doing a parasite purge protocol. So VRMs 1, 2, 3, and 4 with bind and WO oil. L-gut is a fantastic supplement for leaky gut. That's what we will be adding in, as well as Vista 1 and 2 for her leaky gut protocol. And yeah, that's the gut stuff, all based off of a white blood cell count. if lymphocytes were to be high, say if she had that viral, remember, Vivi, that's going to become a good friend of yours for attacking this virus. So there you have it. There's a CBC with differential. You now are good friends with it. It's up to you to become best friends. And if you are one to order labs, be sure you get this CBC with differential. If you just get the CBC, you're not getting enough. Thanks for joining me. Systemic, thanks for having me. I'm Dr. Kylie. Enjoy those CBCs, guys.